Hi, George. This is me,
Hello.
Nadia, from
Hi,
Zen
Nadia.
Onco and Love Heals Cancer. Hello. We guide cancer patients in adopting an integrative oncology treatment approach. We help them find the right balance between mainstream treatment and complementary treatment approaches. We help patients with our team of oncologists, lab experts, nutritionists, and other healthcare professionals in getting the best treatment outcome for our patients, right? So we also help in connecting patients with other cancer warriors and caregivers like yourself here today. When a person relates to another story, they get to know that they are not alone, and
Yeah.
that is the intention here. They have
Okay.
gone through. We've all gone through different journeys and different stories of people, and a lot of us have had queries regarding this, right?
Yes.
So what we're trying to do is set up a platform where people's queries are answered, and in that way, the inspiration is reached out to everybody, right?
Sure.
Yeah.
Yeah.
So you can take it from here, sir. This is your story to tell. The whole world is listening through me, and Zenonco and Love Heals Cancer wants to thank you on our behalf. We would like to really thank you for taking the time out. And it's a busy schedule out there, and time. I mean, the time difference also matters. So we really want to thank you for being here in the first place. And of today, this podium is yours.
Thank you. Thank you. I'm glad to be part of this, and I wish something like this was available when I was going through my personal journey. And this was the issue was for my dad, Mr. Chirail Worky Francis. He was 69 years old when the prognosis was made, and it was squamous cell carcinoma. That's the cancer name. And it all began with a regular checkup or a visit to a dentist. He had swollen gum, and he just wanted to check it out. And the dentist, on the first visit, they looked at it and they said, "Oh, okay, this seems to be a problem with the tooth," which they promptly removed. And
Right.
within 1 month, my dad still did not feel the swelling within the gum going away. So he visited the dentist again, and at that point, they looked at it and they said, "Okay, it looks like you have a growth in your sinuses, so in the sinus area by the nose." And they said, "You go and meet a specialist for this," and which my dad did. And the specialist immediately used a scope and they looked inside the sinus area, and they saw a pretty significant growth. And what they suggested was immediately go for a scan and get a full MRI, or rather a CT scan done for to investigate how big the growth is.
Right.
This happened to be right around the time when my dad was planning a visit to India. In fact, just 2 days after the visit with this doctor, he was flying to India. We are based in Plainsboro, New Jersey, yeah,
Okay.
USA. So just to give perspective, and my parents lived with me here in the New Jersey house.
Yeah.
So my dad, he was also IT professional and working for the federal government of USA, and he was taking or planning to retire within a year and goes back and settle in Kerala, India.
Yeah.
So this trip was very important to him, as he was planning to build a house
Mm.
there, a retirement house, and live there for rest of his life. We did not see this coming, and so he said, "Okay, I don't have the time right now." And the specialist, the doctor, he said, "Well, you should not lose any more time on this, so why don't you do the scan when you're in India?" and my dad agreed to that. He got a prescription. So when he was visiting India, he got the scan done, and the scan results, the doctor who was looking at it, he immediately said, okay, this looks like it had spread, the tumor had spread pretty much in this whole area. And they said it seems to be a very aggressive tumor, so you need to schedule a surgery as soon as you get back to USA. And
Right.
that sort of started our journey towards the rest of this was 2017 February. So the whole of 2017 was then dictated by this prognosis, and my dad came back in a month. So he was back in March, approximately middle of March. We started visiting multiple doctors just to see what was the right way to go about it. And it was pretty clear that he needed a surgery to remove this because it was pressing on his nerves, and he was losing sensation in his upper lip area.
Right. Right.
So and scheduling a surgery takes time, especially this type of complex surgery. And we were referred to the University of Pennsylvania Medicine, UPenn, and so they call it Penn Medicine. That's the facility name, and it's a very famous university in Philadelphia,
Hmm.
and medical school as well. So we got a time appointment with a specialist there who looked at my dad's results, and they scheduled some tests on there. And it no matter how fast we wanted it to be done, it took approximately 2 to 3 weeks before we could get him to the hospital surgery session. And this was the day after Easter that day, so Monday in 2017. And we just did not know how it would go. And there was one area I just wanted to, I missed telling you this, but when we initially tested, there was a question about whether this tumor is malignant or not.
Right.
And so that also we did lose a little time there. The first time it was tested, it came out as non-malignant, so
Hmm.
which means that there's no cancer, and we were very elated and happy with that. But the doctor was not convinced. He suspected that this was malignant just because of the way it was growing. And he did another test, and unfortunately that came out positive and malignant. So that's how the surgery had to be scheduled pretty quickly. And so on all this happened within, so 2 to 3 months. So February, March, and mid-April we are getting a surgery done. And it all came to our family as a shock. We were sort of in denial that this could happen to him. And my dad was at 69 years old, but still he was a very fit person. Did everything much better than me. I was in my 30s, but he still had a great personality, very optimistic person. So he was handling it well. And for the family, we were just there to support him. So it's myself, I'm the only child, and my mom. We were the primary caregivers uh,
Yes.
for him through this process. And my rest of my family, so my wife and my two kids at that time, they
Right.
so their kids were young, so they didn't really know what was happening. But yeah, when this was our core family living with him, taking care of him. And so the surgery, it was 13 hours long. and it was a very complex surgery because of the face area is
Yes, yes, yes.
full of nerves, and they had to be very careful. The doctors did a great job, and after 13 hours, he came he regained his consciousness, and my dad was in his jolly, cheerful mood. And so, I mean, what amazed me was that he went through all this pain, and he knew the life had changed drastically in the last few months, but he was holding it together and not. I still don't know if it was for us to see or for himself to experience that and keep himself going strong. But regardless, that approach and his attitude really helped not himself but also his caregivers as we went through this. And yeah, he came out after surgery, and obviously they had to cut up this area, and a lot of swelling and pain, but he handled it well, and within a week he was discharged. We brought him home, and uh, that's when the challenge began. So the 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 diagnosis was that if this comes back,
Right.
the tumor with comes back,
The
uh,
recurrence.
then yes, then it can be a concern, or else it can be managed. That's what the initial outcome of this analysis was. And what happened was, within a month it came back. So the issue was, he was having already, because of all the surgery, he lost all sensation in his mouth. He couldn't chew from this side,
This was the
and
left side, right?
left side, yeah. And uh, so that 1 month before we went back to the doctor, it was a journey in itself just to recover from the surgery. And so he was initially only getting fluids,
Hmm.
and they were not even allowing him to swallow anything because of the whole muscle there needed to recover. And
Right.
so that in that 1 month, me and my mom, we were taking shifts like 12 hours. She would take care, another 12 hours I would be taking care. And we got a hospital bed installed in our house, and so to get him as much care as possible.
Possible, right.
And he was doing good. And by the first 2 weeks, he actually felt much better, and he was able to start eating, and was on well on the recovery road, at least from the surgery.
Right.
So everything, we were very optimistic when we went back to the doctor.
Okay.
But that visit, the surgeon, he looked at my dad's new scanned reports, recent scanned reports, and he he pretty much said that there is not any hope for him. So in America, the doctors can be very honest and candid about this.
Yeah. Very blunt about it.
Yeah, so they can. And it depends on each doctor too. So in this case, this surgeon, I mean, he didn't sugarcoat it. He said that, I don't think he was being practical. Now that I look at it in hindsight, he did say that there is this type of surgery. I mean, the tumor, it's so aggressive that no matter what you do, especially because it's in your sinus, which it will eventually spread to the brain, and there's not much they can do. I mean, they cannot ever completely take it out from the system. So and it's better to just live your life as is, without going through any further treatment, and just let it take its due course. And we didn't see it coming. It was me and my dad. at the doctors. And we
I mean,
actually had a,
we don't see these things come. We just
yeah,
don't.
yes, and especially it was like a bumpy ride. You're going through it, and then you feel okay, we are fine now, and suddenly another bump comes, and
I understand.
it just my dad was at that's when I really saw him for the first time, really thinking about it, where is this all heading, and I said, okay, let's not worry about it. Let's see what there was another oncologist whom we were going to meet right after this appointment. So I said, I think we should just give him a call and see what he says, because this surgeon already said, don't do anything else, just go home. And that my dad was a fighter always, so he said, that doesn't make sense. I mean, if we don't fight it, there is no chance, but if we fight it, there may
Exactly.
be some chance. And so for that reason, we gave this doctor a call, Dr. Lukens. And on the phone itself, I said, doctor, so I'm calling because my dad has been told that he shouldn't pursue any further treatment. So what should I do? And the doctor was like, come over, let's just talk about it, and let's go through your scans, and we will discuss if there is anything we can do. So we went there, and a very nice gentleman. He looked at my dad's reports, and he said, "Okay, there is." So he was a radiation oncologist. So he said, "We can use radiation and try to manage this. We will never be able to cure it.
Yeah.
So, but we can try to prolong the life aspect
Yes.
by managing the growth of the tumor."
Yeah.
And so I asked him directly that, what would you do this if it was someone, your family member? Would you actually go through this, or what would be your analysis or decision in that? And he said, if it was my father, I would have done exactly the same way of treatment. So I said, if after I heard that, I was like, okay, there's nothing more I need to. I mean, if a physician himself is putting his confidence in this, I said, okay, let's go with that. And my dad was completely on the same page, and we started our journey again. And that was for another 2 months. They said, okay, so where he went through probably 40 or so treatments, the
Hmm.
radiation treatment.
Right.
And that whole thing was again a complex thing. In the morning we would have to take him there, and it took roughly 3 hours for the whole thing. I mean, the treatment itself was 10 minutes, but just the process of getting, so it was 1 hour. This hospital is 1 hour away from our house, and we stuck with that hospital only because it was the best in this area.
Yeah.
So we decided, no matter if we have to uh, go a little or travel a little more, but if it gets the best treatment or care, then that's what we wanted. So
Right.
yeah,
Right.
so 1 hour back to go there, another hour to come back, and at least another hour to get him through the radiation treatment. So easily 3 to 4 hours every day when he was going through treatment. So luckily, my employer, they were very supportive of this,
Wow.
and they just said, take your time. So I was still working, so even if I would be taking him to the hospital, I would have my laptop with me. So while we were waiting, I'll do some work, and then when we came back, I would try to complete or finish up on whatever I was doing. So um, but it would not have been possible if the employer did not support this. And I mean, I cannot thank them enough for that. They did the whole uh, 10 months or so that I was with my dad doing this. They never asked me, where are you with any projects or anything. And thankfully, I still had the resolve complete it. I mean, I was disturbed personally with what my dad was going through,
Yeah.
and but whenever I could, I would try to just get my work done, and that also was a way of me trying to cope with what was happening. So
Exactly. Yeah.
something, yeah, work is not what you want as a coping mechanism, but it actually, in some cases, it was
Yeah.
helpful that I had something else
Distracts
to
you.
think. Indeed, indeed. So I did. So work was one way I was coping with this, and then my family. I have young kids, so they just taking care of their day-to-day requirements also was another major distraction
Yeah.
that helped me
Yeah.
just refocus. And so yeah, so we went through the radiation treatment for a month and a half, and they said, okay, so come back in a month. We will do another scan, and as long as it doesn't spread to any other area, you will be fine. That was the radiation oncologist thing. So we did another scan. This was probably in July, and we went back to the doctor, and that was again another bump in our
Yeah.
journey. They found a new cancer spot in his spine.
Oh.
So we were like, okay, so this has spread, and the doctor said, uh, as long as the spread, we'll have to see every month. Will be we will have to understand, if wherever they're seeing the spread, they're going to treat. But
Yeah.
they just they did tell me that this is very aggressive. They've not seen that type of cancer. He was When they initially did the biopsy, they said this is a third stage
Mm-hmm.
cancer. But the way it was going, he said that there's it's easily at the fourth stage. There's
Right.
nothing they can really do, and so we at that point we had to make a decision, like, do we continue with the radiation? Is there anything more that can be done?
Right.
And at that point we started considering chemotherapy.
Okay.
So so in chemo, so we met with a doctor called Dr. Hartner, and he was another straightforward guy. He would just tell you everything on the face, and he said, again, there is no treatment. That was and for this specific cancer, there was no medication. So so there, when you hear about blood cancer and lung cancer, those it's a much more common occurrence, and because of that, drug companies make medication
Mm-hmm.
for those. So there is some level of treatment available for those, but there is not. If you just look at this specific cancer, they did not have any real, not much research has been done, not much medication has been, or there was no medication basically. So uh, one suggestion that doctor made is there is a medication that works on for bone cancer,
Right.
and that, because it was spreading to his spine, and they said, okay, we could try to use that and see if that would help.
All right.
So, and this was just an oral pill, and not any injection or anything. So we said, okay, let's try it, because we don't have any other options. And my dad was, okay, we need to keep trying, and we cannot just sit at home and wait for this. So he said, okay, let's go through that. So that took us to a different direction. I mean, we're still doing our radiation to his spine, and but this whole thing, we had to meet um, food. I forget the term, but she was so one dietitian. We met a dietitian just to understand what type of food intake he could have, because there are side effects
Yeah.
with the consumption of such a medicine. And uh, so we met them. We met a speech therapist because they said once you start this process, there is a chance that you will have some irritation in the throat, and your speech may be impaired, and also how you eat and all that, it can be affected. So we did all that, and we came up with a plan. It was tough for him because that medication, when he started consuming it, it just wouldn't stay in his system. He would start throwing up, and even he lost interest or appetite in none of the food that we would make would be good for him.
Agree to
So
him. Yeah.
yeah, yeah. So and so it took maybe a week just to get him back on his appetite and regain his appetite. And eventually he was okay with that, and he was able to manage with that medication. So I mean, he will still have some episodes where he would uh, throw up, but maybe it was reduced to twice a week from every day. So that was in itself a small win for us, that okay, he's at least on medication. And we wouldn't know at least 2 to 3 months later if it was working for him. So we went through all this, and in November he was fine. I mean, he was back. His whole surgery part had healed more or less, and he was eating. And this is the time when my daughter, she had started preschool. So we were
Okay.
trying to this was a unique situation because it was not part of our school district, and so there was no bus transportation available. So
Oh,
my dad said, hey, I will go drop her and pick her up. It's only 2.5 hours the school time, so I'll drop her around 8:30 and pick her around 11:45. And I was like, are you sure? And he said, no, yeah, I'm home. And he actually had gone back to work as well, so he was working remotely.
that's
uh,
amazing. Oh my
yeah,
God.
so so he had taken 6 months time off during this surgery and all. So the option was either to quit or just continue working, and he said, I'm going to work. And so so he was working. He was taking care of my kids. So not only just my daughter, but then they had karate class in the evening, so he would take them. So, and I also didn't say no to it because I felt that that kept him
Yeah.
distracted and positive. So so he was doing all that November through November, even into the beginning of December. And at that time, one thing we noticed was he was losing weight, so and which was worrying us. Then we thought it was probably the medication and
Mm.
side effects of the medication. And he started complaining about some pain in his hip area. And
Okay.
uh, one thing we learned from this whole experience, at least in his specific case, was when you complain about pain in some area, that potentially meant cancer had spread to that area. So we were not very positive about the whole this new discovery. And so December first week, there was another set of scans that had to be run. And we preemptively, I called up the doctor, and he said, get the hip area also scanned, because let's see what's going on. And
Okay.
so this was the first week of December. So all these times, our numerous trips back and forth, it was a special experience with my dad, because we just, me and him in the car, and we would talk about life and things like that. So his whole focus was, one, the house construction in India, when it was going at a good pace. And his thought was, so if it all gets done in March of 2018, then we'll go and get the rest of the treatment there or something on those lines. And I said, but I cannot come there for the treatment. I would rather want you to stay with me so that I can take care of you. And he said, no, yeah, his preference also was that I be around him. And they said, okay, yeah, we'll think about how we go about it. And one the other area that I wanted to also bring up is during this time, my one of my cousins, Jisha, and her husband Daiji, they were strong supporting pillars for us through this, and another friend called Sunil. So three of these three people, individuals, they took turns occasionally to take my dad to the hospital, and just staying there. If there he had to stay for a couple of days in the hospital, then at night sometimes it would be Sunil or Daiji, or myself. I mean, depending on because it it came to a point where it became so redundant. Every day it was, this is all you did. Yeah, so they saw that it was getting to me, because I was getting really
Affecting you as well, yes.
yeah, yeah. So they and because of that, I think I was able to continue the journey, and so some breaks in between really helped me through that process. Same thing with my
Right.
mom. I said, well, we never took her to the hospital for this. I said,
Hmm.
don't worry about that. You stay home, and if it at all comes to it, then I am there, so you don't have to worry about anything in terms of care for him at hospital. So that way we were blessed to have some friends and family who were close to my dad through this process. I mean, my dad was not too comfortable to have many more people come and help, and he was like, okay, because it's all very personal. And so we did have a lot more friends and neighbors who were helping us in other ways, just getting the groceries done or things like that, because I was away. I just, by the time I would come back home, it would be too late. So in other ways, a lot of people contributed to this journey. So December first week, we just spoke. We went to a new location for the scans to be done, and there was a beautiful farm next to it, and it was full of Christmas lights and things like that. So there's a fair. Christmas fair in that area on the weekends. So I said, okay, Dad, next week let's come back here, and I did not know that it was so close to our house. So we'll go through that. And he said, yeah, let's do that. So everything upbeat. We were looking forward to that. And just that weekend, um, uh, my dad, he was just helping my son get some printing paper from his room. He went,
Right.
and I heard a loud sound from my bedroom. I ran to his bedroom to check on him, and I saw him. He was on the floor, and he said, I don't know what happened. I just fell, and I had to help him up. But when we helped him up, he had extreme pain in his hip area, and he said something's really wrong. I don't know what's going on. We had the emergency people come in. We took him to the hospital, and it was the worst fear that we had. One, that he had broken his hip, and two, he had cancer in that area. So the most likely, we still don't know to this day whether he broke the hip while he just bent over, and or whether the fall impact was the reason for his hip fracture. But regardless, I mean, cancer was spread in that area, and so we had to immediately take him to the hospital. And we because this was an emergency, we took him to a very close by hospital just to get it looked at. And the doctors there said, okay, because it is a complex case, it's better recommended to take him to the original hospital where he was undergoing treatment.
Right.
So we had to schedule another transition from this hospital to the Penn Medicine hospital. And all this, it really shook me up. And I just couldn't handle it. In when we were he was being taken in the ambulance, I was in the my car alone going there, and just couldn't hold myself. I was pretty much in tears all the way there. I called my wife. I was like, this is not good, the whole thing. I just felt like all the months that we had been with him, I felt that this is not going in the right direction. This seems to be like his time is coming pretty soon. And my wife was very supportive about that, and she said, "Don't worry. Let's just trust in God and see where this is headed." So we went to the hospital, and my cousin, I mean, Daiji, he also came there. He stayed with me that night, and again he was there for roughly 2 weeks in the hospital because of the fracture. The doctor said, we don't have time to lose, so let's get him radiation while he was in the hospital itself rather than coming back home and doing it. So we started treating it. So I mean, it was just a very crazy schedule with him already in pain, but we had to schedule someone to take him to this radiation room, and all this just took a lot of coordination. And his pain, it was pretty intense, but he handled it very well. He said the only thing is, what I cannot bear is just when people move him from one bed to the stretcher. He said, just so I was always there when that was taking place, and just reminding the people, because the staff who would come to do this, they were not always aware that he had a fracture. They were
Fracture.
there to
Yeah.
just get him for a scan. So I had to always make sure that please understand that he has a fracture, so please be very careful when you do this. And same thing with the nurses. So I had, because I had been with him for all these days, I understood what he needed. And so I would be the one telling the nurses, okay, this is what he has been going through. So they wouldn't need the nurses to talk to each other. They were had full confidence in me. So they were like, okay, this person knows what he is talking about. So I would share all the input as to what he has gone through, what medication he had, what dosage, all those things. And so in December, that was maybe the week before Christmas, he was finally back home after all the treatment was done. And I mean, we still had to take him for further radiation. And
Hmm.
so, except for Christmas Day, even on December 24th, we were there. And we celebrated Christmas. It was a very muted celebration. And but he was upbeat. Even then, we every year we have three or four families we would get together for Christmas. So they actually approached us, and they said we would still like to celebrate with Uncle. And we were not thinking about it, but we said definitely, I think he would also like that. So we all celebrated together. I mean, and uh, at that time I said, okay, Dad, he was also coming to terms with this, that it did not look good. And I said, you know what, treatment in one place, that's fine, we are going through that, but today is the day we should celebrate, and let's have a drink together. So we had a drink together. And so all in all, we could whatever we could do to keep him upbeat, and ourselves upbeat, we did at that point. And in January, he was again working through this. Whenever he was out of hospital, he would get back to his laptop, and he was having meetings. And his co-workers knew him as a very jovial guy, and so he was still the same. No one would really know that, oh, he was going through all this during the calls. And um, so after that, in January, we uh, he was completed all his treatments, and that's when we were told that, okay, so there is no more treatment that we can do for him. I mean, this came from the chemotherapist, Dr. Hartner. He said, you know, and my dad was like, let's get that. There was another medication that they were talking about, because this oral pill, it was, they realized that it did not work for him, so they asked him to stop that. And they said, okay, this is IV provided medication, but Dr. Hartner was like, I don't recommend it. There is no reason for you to even try this. The chances are, next to nothing that it would work. But my dad, he insisted that he would like to go through it. I mean, we do not have any alternate medication options, so we did think about using some natural therapy, or and we had heard of something in
Yes.
Karnataka area, that they were giving some medication, and it worked for a lot of cancer patients. And we were thinking, oh, maybe we can look into that. But he was not in a condition to travel at that point. So we said, okay, so maybe let's wait for him to go through this initial chemotherapy. If that helps him, then and if he's travel ready, then we can take him back to India and give that last shot. So this was in mid January or so. So we started the chemo.
Okay.
He went through one session, and after that, he could not do any more chemos because his immunity level completely dipped. And they mentioned that if the immunity level is not at a certain level, then you cannot receive more chemotherapy. And it only because chemo, it really kills all the good cells, and it makes your body susceptible to any illness out there. And that's what exactly what happened to my dad. So I mean, we had changed our house to for his needs. So we made a makeshift bedroom in the first level itself, because he could not climb the stairs after the broken hip. He was initially in a wheelchair, but the physiotherapist, they came, and they were able to help him use a walker and start moving. So he was moving around, but in the house. So but even the bathroom, everything was downstairs after that. And uh, not sure, at that time, uh, he wanted to, definitely take showers and things like that every pretty much on a daily basis. And we said, just be careful. We were worried about him falling sick. And but just would pay heed to what he wanted. And unfortunately, I'm thinking, because of the cold weather, it was extremely cold at that time, he got pneumonia. So and he had a fever. When he got a fever, we were told that if it is above a certain temperature, then you have to immediately bring him to the hospital because of the immunity situation. And mm, we did take him on a Friday night. I mean, it was January 19th. I mean, I still have all these dates in my mind, because we took him immediately to the hospital and stayed there overnight. And my friend Sunil, he was also at our house, so he joined me. We sat through it. By Saturday morning, his temperature was under control. And they said, okay, he needs to stay here for some days just because of his pneumonia. We need to take care of that. And uh, so say on Sunday or so on that weekend, he was fine. He was doing okay. Again, working on his laptop, and at that point, he told me that, it seems like I'm getting tired of working and things like that. So maybe after this hospitalization is done, we'll probably make a decision on that, and just go to India. Will not wait for March, but maybe sometime in January itself, we'll go to
Yeah.
India. Yeah, and I said, okay, that looks like a good plan.
Hmm.
Um, that's uh, so no, my father, he comes from a large family, so 10 siblings, and one of them, they live in Houston, my uncle, and they, when they heard about my dad being sick, they came to visit on that specific Monday. They were here, and they were taking care of him. They said, okay, you go home tonight, we will take care of him. And so my dad and dad's brother and his wife, they both took care of my dad that night. And next day, so my aunt, her name is Geeta,
Yeah.
she said, she spoke to my dad and she said, how about getting my mom to the hospital? Would you like that? Because he was losing interest in eating food. Hospital food is in general bland.
Yes.
So, my aunt said, how about I bring you some food from home? I mean, so she asked my mom to come over on Tuesday morning. So when I went back, my mom took some breakfast and lunch for him, home cooked, and she fed him. He was very happy, and things looked okay for that point. But in at that point, that was the first time my mom had actually visited him in the hospital. And after the surgery, she was there for the surgery, but after that. The first time, and she spent the whole day there. And in the evening, we were planning to come back, and at that time, he started having trouble with breathing. And it was something that was going on through the day. We didn't really understand that, but his oxygen levels were dipping in the
Okay.
body.
Okay.
And uh, by the evening, or by the night, it was, he had to be put in another special breathing apparatus, which would help
Give him
push
oxygen.
oxygen.
Yeah.
Yeah. So when it was done, before he went to bed, we spoke to him, and he, again, he didn't really think that it was serious. I mean, he was upbeat about things, and we said, okay, we'll talk to you, and you just relax for now, because that day he was sort of disturbed all day with this breathing issue and all that. So I said, you just go to sleep, and then we will, once you regain your energy, we'll talk. And so they gave him this, and they gave him sedation actually at that time, just to relax him. And he went to sleep, and that's when the doctors came to me and they said, if something happens tonight, like his heartbeat is, twice the normal, pulse rate is twice the normal rate, and he may have a cardiac arrest overnight. So what do you want us to do? And I was like, you treat him. What else can I tell you? And they said, no. The thing is, he's at this level where, resuscitation is not going to help
Help.
him. I mean, it may help him live for another day or so, but then his lungs will fail, because his lungs is already it has pneumonia. It is damaged because of the pneumonia, and it's just at a place where it's no road back. No, there is no recovery happening.
Yes. Yes.
And I said, okay, so what should I? And so they said, okay, we are going to stop all the treatment,
Right.
and this is only hospice. What they will do is manage his pain
Right.
and let it take its due course and let him pass. So that was a big blow to us, and we just did not know what to say. So, but we had a discussion beforehand with the doctors and my dad, and my dad had said that if it did come to that, then there no need to resuscitate, and let's just go with it. So, and so because he had said that, I was able to say that okay, this is what he wanted, and we will go with that approach. So that was the last time I spoke to him, and he stayed in that condition for roughly 36 hours. And at that time also, so my aunt, she was there with my mom throughout, and it helped a great deal that my mom was there in person with my dad. So she came to, you know, acknowledge that he was going to pass away soon. And I mean, I'm just glad that my aunt thought about it, and she was able to bring my mom, and they both could spend, dad and mom could spend that day when he was awake. And yeah, so by Thursday, so January 25th, he around 11 o'clock, he passed away, and in his sleep. And um, we had to just, his last wish was to be buried in India, in his hometown, and so we started looking into how to do that. My church, whole community, they came together. They After that, we didn't. I mean, I was pretty much in a different world. I just did not know what was going on for the first 2 days, but I just wanted to ensure that everything was falling in place for us to take him to India. So there was a lot of paperwork and things that was required. So again, community members, they went through that whole process, and we were able to take him. And next week, the following week, we were able to take him for the funeral and have him buried in his church where he was baptized and all that in his young age. So that was his wish. We did take him to the house which was still under construction, and that was his wish. I mean, I wish he could have seen it. It was not ready, but the structure was ready, and so we kept him there for overnight. And I mean, that was the least we could think of. That, I mean, at least his mortal remains were in that house, and he was buried the following day. So I mean, that was my my dad's and my journey in this cancer case.
Wow, I am just filled with so much inspiration myself. Like, look at you speaking with so much power today after, what you went through. It is, I can imagine at that point in time, what you went through was nothing. You wouldn't have had this mindset to even speak about it. But
Yeah,
where you are right now, you're speaking with so much power, with so much understanding, and in hindsight, you actually went through the whole journey as you said it to me, step by
yeah,
step. And um, through by doing a video like this, you are really honoring your dad. You're giving out that inspiration to everybody, because it is, I see in your entire story there are so many people who have come together, the community, your family, everyone who's come together to make it happen. So not a
yeah,
lot of people are lucky enough to go like that.
yeah.
Yeah.
I was very thankful for the family and friends and the community members, and that's what I would say as a message to not just the caregiver, but the extended family and friends. they, if you see someone in going through this, definitely help them out. Be there. You don't have to do anything. Just be there in person. Sometimes check on them occasionally. Do some basic thing that, just do their groceries for them. Don't ask them, hey, do you want your
Exactly.
groceries to be done? Actually go and do it for them. And that it actually comes back, and it helps that individual, the caregiver, and the patient going through this. So that's one thing. Yeah, take care. Do things without them asking. Just be there. And also, if in any uh, place, if you can give that caregiver any break, by alternating care for this individual, do that. We had some family members who came, or even friends who came to our house when my dad was going through this, and they said, you go do your work. If you need to focus on your job, do that, and we will be here with your dad for the rest of the day. So those small things go a long way in the person's journey.
It's what adds up, if you ask me.
Yes,
And
yes,
you tend to pay it forward. So
yeah,
hence, there's a lot in connection here. There's a lot connected in how we affect other people's lives and how they are dependent. We are all interdependent, I would say.
yes,
So
yes,
that
indeed,
comes together when something like this happens. Now, like you said in the beginning, you never even imagined something like this
yeah,
coming to us.
yes,
So it was beyond your imagination, it was beyond your
indeed,
control. But I must say this, you did everything you could. You did everything you could to the best of your ability. You're your dad's only son,
yeah.
and I'm pretty sure he's so proud of you wherever he is.
Yeah, no, that was one of the best moments when the day, I mean, before he passed. I mean, I had some time alone with him, and he was ready, and he was accepting that he was going to pass soon. I mean, he didn't seem that, or he knew that it was coming, and he said, I only have one regret, that I couldn't go back to India to see the house and all that. But otherwise, I just had a great life. I'm content with everything that I have gone through. And uh, he said, I'm glad to have you around. And, you've done more than I would have expected you to. So I'm very happy about that. So, I mean, that I cannot forget that. So, I mean, that just keeps me going for the rest of my life. So
That I mean, it's a father son thing. I can completely understand. It's something to do with your parents and how. I mean, parents when they give us a compliment also, I know how much it can affect everybody. So I
yeah,
mean, it's a thing. But even still, um, the way things unfolded also had a lot to do with the kind of personality your dad was,
yes,
jovial person he was, the way
yeah,
people came to help him, the way they all flocked to him. So if
yes,
it's positivity that you give out, that has that coming right back at you also,
yeah,
right?
indeed,
Right.
indeed, yes.
Yes.
And
So
people remember him even now. His personality was such that he would bring together the community. So Onam, so we are Malayalis, so we celebrate Onam, and that was one of his highlights. So he would organize Onams in such a way that there would be groups of people serving food, everything in a very meticulous and orderly fashion.
yeah,
And people remembered him for that. Even like this past Onam, I got many people coming back and saying, "Oh, we remember Francis uncle. We miss him during the Onam functions," and they are actually doing the things the way he had scheduled and planned it. So they continue doing that. And there's in Richmond, he spent some time in Richmond, Virginia, for 12 years of his time here, and they are still organized like 300 plus people Onam function, and they always remember us in those things. So it's
amazing, amazing.
yeah.
So have I don't think I said this, I'm Malayali too.
Oh, Oh,
So I completely understand when you tell me about Onam. I
yeah,
completely understand when you tell me about a big family and coming back home, and
yeah,
home is home. So I didn't say this in the beginning because I thought it should, I should say it
yeah.
later on. But
Okay, no, glad to hear that. I thought you're probably Tamil or
no, I'm Malayali.
yeah. Okay, okay, okay.
I'm Malayali Catholic also. So
Oh, great. Okay, okay, okay.
completely understand. Not an issue. So
Okay.
yeah, and more importantly, it is uh, you the way you've explained your dad's life. I completely it is like I watched a movie. So the way you've given your message out to everybody out there who's maybe a caregiver or a patient out there, who's watching this, who's listening to this, what are your words of wisdom there? What are your words from this entire experience? It has been ups and downs for you,
Yeah,
complete roller coaster rides, times where you did not know what to do, times where you couldn't get a hold of how am I going to go through this, times where you doubted yourself, am I doing enough? I
yeah.
mean, there are so many emotions that you went through.
Yes,
So for someone who, and yet you were blessed in a lot of other ways, where people came in, people showed up, and they were there, and you had someone like your mother who was
yes,
very strong, who
yeah.
stood by you in all the
Indeed,
caretaking part of it.
yes.
So, to someone who does not have all that, what do you have to say?
My thought is that so caregiver, well, it's a caregiver or the individual who is going through this, never lose hope, and even if, I mean, it's not headed in a right direction. I just hope it doesn't come to that. But um, as even my dad, I just have that example because he's the one who went through this. He was positive and optimistic about this till the last day. When he went to sleep, he said, "I will talk to you when I wake up." I mean, he was that positive. I mean, he knew it was coming. The doctor had bluntly told him that you probably have 2 months to live, or initially they said 6 months, but every time we met them, they would give us a lower number, and very drastic, like just in within 2 weeks time it came down from 6 months to 2 months. And but um, I only once did I see him uh, cry a little. I mean that, and that too, I mean, it was because there's someone else in our family was going through some trouble, and he was trying to help them, and that was not um, uh, enough at that point. So I mean, that was the reason he was in tears. But so that's the only time through that whole 9 to 10 months time, that even after the such a intense surgery, he was strong. He came back. He was joking. Like I said, when he regained consciousness, my mom was next to him, and uh, his one eye. I mean, because of the surgery, he couldn't close his eyelid at that time,
Yeah,
so the tears would keep coming from here because
eye
So
keeps watering.
yes, so my mother, she used a handkerchief to just wipe his tear, and so he couldn't speak. So he wrote on a piece of paper and said, "Oh, this is Mary Magdalene wiping Jesus' tears." So everyone who was standing, looking at this man who went through 13-hour surgery, mouth swollen, cannot speak, and he's joking in that. So, and my message is, I mean, for any individual who's going through this, I mean, it's the toughest thing for them in their life. But just from seeing my dad, I think it helps not only that individual cope with this journey, and but also people around this individual who are going to be the mainstay, or the pillars of support through this journey. It encourages them also to keep going. Optimism and positivity, keep that. And to the caretakers, I would say same thing. Just it would be tough don't show your weak part to the individual who's suffering, because you have to always remember he is the person suffering, and you are just the part who can help. So don't be the part that weakens his resolve or his or her resolve. So yeah, I would be in tears, but I would do it completely away from him. And so you need to cry sometimes
Yes, yes.
just
I
to.
mean, yeah, caregivers need that kind of counseling. You
Yes.
need to let it out.
Oh yes.
This is something that gets sidelined a lot because
Yeah.
everybody's concentrating only on the patient, the one who's
Yeah.
going through it.
Yeah.
Nobody bothers about the mental state of the caregiver, and that is
Yes.
something why we are trying to do more interviews with you,
Yeah.
so people know that okay, it's okay to go through such a
Yes.
thing. It's okay.
Exactly. Yeah, I mean, my mother is a good example of that, because she was so strong through this. But I told her, I couldn't give her the full facts at that time.
Mm.
And so even though I knew that my dad was not doing well, I kept it away from her. I just gave her hints that, okay, it's not uh, that good, but we still have hope. So I kept it that way so that she could handle. Because I knew if I would have said been as blunt as that doctor, then she would have just shattered at she. And despite all that, within those 10 months, I seemed like she had aged 10 years. Just the stress on the individual. So I mean, I tried to make her also vent all this, but um, she's very strong in these kind of things. She would not, you know
Yeah, I
cry.
understand. I
So,
understand.
but only after my dad passed, she was able to come to terms with that. But yeah, that's my thing. So as a caregiver, you make sure you can emote to someone, or even to yourself, but do that, come to terms with what you're going through. And also, don't hesitate. Try to ask for help. If you Because there are some individuals who won't
It's
come
not
and help
easy
you.
for them to ask.
Yeah.
Yeah.
Yeah. So just but if you ask, the chances are that you will get someone to help. And because without that, no one really knows what you're going through. And those other individuals may not have seen. So like, I know now that if someone is going through this, I should offer this to them. But others may not have gone through this in their life, so they wouldn't know that. So yeah, definitely ask for help. And hopefully you would get that support from others at that point.
Wow. Thank you so much, sir. Thank you so much, George, for being with us here today and sharing your story. And it's just been such a pleasure for me, and I'm pretty sure for everybody watching this video. And keep inspiring us. Thank you so much for taking the
Sure.
time out from your schedule. Thank you so much on behalf
Sure.
of Zen Onco and Love Heals Cancer. I want to thank you from the bottom of my heart.
Thank
Really,
you.
you have been through an ordeal, and here you are sharing your story with us so powerfully. More power to you. Keep inspiring us.
Thank you, Nadia.
Thank you so much. Good day to you.
Take care. All the best.
You too.
Bye.
Good day to you. Bye.